services. So we're a youth-led international civil society organization. We're focused on drug policy reform and full-spectrum harm reduction, which I'll explain in a minute. And we promote the health and human rights of young people who use drugs. We define young people as 18 to 30, but we also do work on issues faced by adolescents who use drugs and try to bring their issues to the forefront, as we were so recently adolescents. We're an organization that's made up of young people who use drugs and young people affected by punitive drug policies worldwide, whatever that looks like. So a bit about full spectrum harm reduction. Full spectrum harm reduction incorporates all of the people who use drugs and all of the methods with which they use them, as well as all of the political, social, and environmental contexts surrounding this use. It aims to include and account for the diversity of factors at play when we consider all forms of drug use and all of the people who use drugs globally. This concept was born when we began to reconsider traditional harm reduction to better incorporate younger generations. So harm reduction traditionally comes from the global north and focuses mostly on injecting drug use and opiate use, also very important matters, as well as sexual and reproductive health. This focus, full spectrum harm reduction, leads to the focus of the traditional harm reduction, leads to the exclusion of a sizable portion of people who use drugs globally, including non-injecting drug use and people who use drugs from the global south, who face a far greater diversity of issues, which can often be as severe as being the victim of extrajudicial killings in many countries. The main guiding principles of full spectrum harm reduction remain the same as traditional harm reduction models. The aim is to keep people who use drugs safe and minimize the harms associated with drug use. By incorporating a wider number of forms of drug use and a wider number of factors associated with drug use, we hope to further reduce stigma, discrimination, and inhumane situations people who use drugs find themselves in. YouthRise believes that it is vital for us to talk openly and honestly without stigmatization about full spectrum harm reduction. Only when we do this can we fully begin to achieve the goal of reducing harm. Next slide, please. So this is a little bit about YouthRise's work pillars, our 4 work pillars, and our 4 goals as well. So we have representation and elevation of young people who use drugs in decision-making bodies worldwide at multiple levels, locally, regionally, internationally. So this means having young people who use drugs speaking and presenting at high-level meetings and regional and international conferences, connecting young people to country delegations, national UN bodies, and civil society organizations, and promoting our inclusion in these spaces, in any decision-making spaces. Developing materials like position papers and briefs on young people who use drugs by young people who use drugs to inform decision makers about our challenges and our needs. And we have knowledge management, so education, research, data collection on young people who use drugs by young people who use drugs. So this looks like creating educational programs and advising on education, drug education for adolescents and youth, capacity building workshops and training sessions to equip our members and also young people who use drugs around the world about the need to advocate for drug policy reform, how to do it, how to access and promote our own rights, and connecting us with health services. Supporting with documenting data collection. There's a severe lack of data, and it will show up through the presentations of my colleagues. There's a severe lack of data on specifically young people who use drugs. The data that is out there is based on fear mongering, and you've got to protect the youth from drugs, but there's very little about our unique challenges, the threats to our health and human rights. And we need to have this documentation there so that we can properly advocate for our own rights and not be left behind. So we do a lot of work around documenting our own needs. Also contributing to working groups and ongoing research that is out there and making sure that it does include young people who use drugs when they're focusing on our issues. Then there's full spectrum harm reduction, which I already explained, but that would look like connecting our young people who use drugs with existing harm reduction services and trying to equip them with the knowledge to be able to advocate for better harm reduction services when they do exist, to make sure that they are youth friendly. Creating materials and guidelines to advise on how to have youth friendly and youth accessible harm reduction. Contextualizing what harm reduction looks like in different regions and different environments to address the needs of the diverse needs of young people who use drugs and their many intersecting identities, and also advocating for these with stakeholders and decision-making bodies to have these harm reduction services available for us. And then we have criminal justice reform. So this would be identifying the needs and pressing challenges faced by young people who use drugs, mapping out relevant stakeholders that we can talk to about these human rights violations, specifically human rights violations and inability to access health is also a human rights violation in itself. And we also do a lot of work with the Convention on the Rights of the Child, or we're starting to do more work on it at the moment as we're looking more to supporting adolescents who use drugs and kind of delving into that a bit more. And this also goes with documenting the human rights violations faced by young people who use drugs and supporting any local advocacy efforts to have this criminal justice reform, drug policy reform, and accessible harm reduction. So then next slide, please. We have our international working group, which João, Anna, and Dinah are part of. So our international working group brings together currently 21 young people who use drugs and young people engaging in drug policy reform and harm reduction in their country or region. The group works together to represent their local and regional communities of young people who use drugs and other young key populations in the international drug policy arena, promoting evidence-based drug policies for youth and contributing to their skills and knowledge to network strengthening. We work with our international working group to achieve our goals, building up their capacity to mobilize young people who use drugs in their countries and regions and advocating for drug policy reform and full spectrum harm reduction. And in order to better represent young people who use drugs, YouthRise depends on the international working group members to communicate the realities and needs of the most affected young people and articulate how to support them better. So we do all of our work with and through our international working group members. And the ways that we do this, I don't want to take up too much more time, but the ways that we do this are through youth engagement, capacity building, advocacy, and producing tools and resources. And I think you can tell how we do this and what the ways in which we do this from what I've already explained. But you can find out more on our website if you like. So that's a bit of a brief introduction to YouthRise, what we do, who we are. And I'm really excited now for my colleagues to explain a bit more about the situations for young people who use drugs in their countries. So thank you so much.
Next slide, please. Hi, everyone. Okay, thank you, Megan. Hi, everyone. My name is João. I'm from Brazil. I've been living in Montreal for the past 2 years. And I joined YouthRise at the beginning of this year, around January, February. And I'm just going to present myself very briefly before I start talking about the reality for young people who use drugs in Canada, and most focusing in Quebec, which is where I live. I'm not in Quebec right now, but this is where I live. I'm visiting my family in Brazil. I started with the drug advocacy work in 2017. My focus has always been more related to cannabis education. When I moved to Montreal, I joined an organization called VoxCan, which is we're going to talk about during the presentation, which is a cannabis organization education in Quebec for youth, and we're also organized and led by youth. I also represent, as I said, Canada and Brazil for YouthRise, and I'm also involved with the Canadian Students for Sensible Drug Policy and with GRIP, an organization in Montreal that I'm also going to talk about more during the presentation. Next slide, please. Yeah, so I decided to bring some data about the current situation in Canada, always trying to focus to Quebec whenever possible. Finding data for Quebec was a little bit more complicated, but for Canada, it was a little bit easier. It's also like a huge challenge for me because I know the audience is from Canada and everyone also likes kind of related to harm reduction work and drug policy advocacy as well. So Canada has seen like a low and stable use of cocaine, like 2%, and methamphetamine, 0.5% of the general population of the country, and an increased use of polysubstance in Canada as a combination of opioids, stimulants, and benzodiazepines. And something also a little bit to worry about in a sense is the presence of fentanyl, carfentanil, bromofentanil, parafluorofentanil, and all the derivations of the fentanyl and all the synthetic opioids like these nitazines. So also wanted to mention that the current drug poisoning crisis, it's not an overdose crisis. The reason why this is happening is the drug poison situation that is causing people to overdose in the end. So naming and framing this situation matters, right? To reduce stigma towards people who use drugs. And as I said, like we're dealing with a toxic drug supply. It's an unregulated market. So people don't know what they're getting into, what they're buying, what they're consuming. And this is the main issue of the situation, right? So in the end, is a lack of policy, a lack of regulation, and a lack of political will to like regulate the market and make those decisions. And this is directly affecting people who use drugs, young people who use drugs, adolescents who use drugs. And yeah, so next slide, please. Yeah, so narrowing more to Quebec, the situation in Quebec is also very complicated. There's increasing death related to the toxic and unregulated market. So 99 deaths in 2016, 541 in 2022. So there's like a huge increase in this period of time. And only in 2023, this year, from January to March, 110 deaths. So more than one person dies per day in the province. At the same time, the province, Quebec, is behind Ontario, British Columbia, and Alberta, related to data from 2022. So the main, the current situation, Quebec is behind Ontario, British Columbia, and Alberta. And another important and very interesting data is that the detection of opioids across Canada, it's inconsistent. So it varies from province to province. In Quebec, more precisely, the most commonly one was hydromorphone, which is an opioid analgesic substance. And at the same time, which is also very important when we talk about youth and youth who use drugs, and this also relates with what Ruby said about the lack of data. According to the National Institute of Public Health of Quebec, the deaths among those age 19 and under and 70 and over cannot be presented by quarter due to there's no number of deaths. So even if we want to know how much was that, we don't have access to this data. And in the end, like in the general, there's a little lack of data from youth and young people behind affected by this crisis. So it becomes difficult to see like this broad scheme of the situation for young people who use drugs in the province. The next slide, please. So as I said, there's this lack of quantitative data on youth and substance use from the National Institute of Public Health of Quebec with 19 years old and below. And in Western Canada, overdose is the leading cause of death in children and youth 10 to 18 years. And at the same time, 2% of overdose deaths and 5% overdose hospitalizations in Canada are children and youth 19 years or under. The data for this slide is from the Canadian Pediatric Surveillance Program. They have a report, and this report has a very interesting section talking about children and teenagers and youth who use drugs in general. And from this group, the stimulant overdose was the leading case with 187, sedative substances 180, opioids 172, and opioid requiring pharmacotherapy 98. At the same time, there are a lot of limitations in this survey. So for example, the results are significant and concerning, especially because they do not include children and youth who do not seek pediatric care after an overdose, and those who receive care from a non-pediatric provider. So we see that the situation, it's not what we see, because there are a lot of other cases that are not there. In this report, for instance, they were not reported at any point. So we also need to take into account that pediatrics provided have a limited access and awareness of services availability for children and youth who use substances. So even people who are dealing with this population, they have a limited access of services and also like the knowledge and how to deal with this kind of situation. And another limitation is the lack of pediatricians specialized in the topic of overdose related situations with youth. And also the stigma towards children and youth who use drugs, right? So this creates a situation where some people might not even seek support because they're afraid of the stigmas towards them. So what we bring from like this report is how can we better inform those doctors, how to reach those doctors with information, how to reach the families of this population of the youth and child, how to share information with them, with the families, with the teenagers, with the youth, and how to make the services themselves, the medical services, more child and youth friendly, and also the harm reduction services as well. And also bringing back to Quebec, one of the specialists in adolescent medicine in Quebec, in Montreal, he said that Quebec might see an increase in this issue as well. And also I wanted to bring like this connection of Canada and United States. So just to show this situation where the communication, the transport of substance between countries is across the international market. So Canada is exporting to other countries, or other countries are exporting to Canada. So this is a communication between countries. Canada and United States, they have like a partnership to deal with this and try to like mitigate the risks and this transport of substances. And this is done by the Canadian Community Epidemiology Network on Drug Use and the US National Drug Early Warning System. And as I said, it's across the international market. So substances are coming from everywhere and going everywhere as well. Next slide, please. And also some drug alerts. I'm going to talk about some drug alerts at the federal level, some drug alerts in the provincial level in Quebec. So I wanted to bring these because I think it's a very good resource. It's always important as people who use drugs to be aware of the kind of substance that we're consuming. Always try to test, analyze our substance before using, and using drug alert systems is a great way to get informed about what you're using. So the Canadian Community Epidemiology Network on Drug Use, they have a drug alert system. It's a partnership and coordinated by the Canadian Center on Substance Use and Addiction. And they have a new news alert system. So if you want to check it out, I would highly recommend to subscribe on their website so you can receive these emails, the newsletter, right? So Health Canada's Drug Analysis Service also has one. And the only nuance about this one is this based on substances that were seized by law enforcement agencies, and they will publish alerts based on what they seized in the past. And since 2019, there was an increase in Ziloxine samples and fentanyl co-occurring in 93% of the samples. And in Quebec, there was an increase of Ziloxine detection, 2 in 2020, 12 in 2021, and 36 in 2022. And as I said, there are limitations in this service because they're going to be based in law enforcement agencies and not people that go there to test their substance, for example. And the St. John's Ambulance also has one. And you can find on their website, there's a newsletter also available based on what they're analyzing, what they're getting from information of drug alerts across the country. It's a great service also, and I highly recommend that you check it out. And the toxic drug supply also comes from this idea of increasing the bulk and enhance or mimic the effects of other substances, right? So also important to check these drug alerts. And also raises the question of how to reach young people, right? The use of social media is a good strategy. The use of the internet, the use of newsletter, the use of telephones or ways to reach young people who use drugs, either online or in person as well. I think someone sent the link in the chat. Yeah, nice. And also in British Columbia, the Toward the Heart in British Columbia Center for Disease Control. This is partnered with health authorities and community partners to send anonymous toxic drug and health alerts by text message. So this can be another strategy, right? Through text alerts on your phone. Also newsletter if you want, or social media. It varies a lot. In Quebec, Cactus it's an organization, a harm reduction organization in Montreal. I'm going to talk a little bit more about it in the next slide. And they have their drug checking service, which is called Checkpoint. And they publish their drug alerts on their social media as well, which is another great way to reach people and young people who use drugs online. So Cactus, Grip, Cipto, Libra, and the Dispensary, they're working together to develop a website to announce analysis results among the substance analysis services in Quebec, because Quebec has multiple substance analysis services, but there's nothing unifying the results of these services, right? So this is a great idea to kind of unify this for the people who live in Quebec, people in Montreal and Quebec City, any other city in the province. Next slide, please. Oops, no, sorry. I think there was a delay in my screen. Perfect. And yeah, so services in youth in Quebec. Harm reduction services, you'll find this on more than 1,200 sites, distributing sterile injection and inhalation equipments in Quebec. So naloxone is available for free for anyone above 14 years of age. In Montreal, it's available in pharmacies and other community organizations. So you can find the nasal spray option plus an administration kit with the other materials. And in the end, we're going to share with you all, we created a resources list for details and links, important resources based on our presentation. And I highly recommend that you check it out. You're going to find a lot of great information there. Also the links of the organizations that we'll be mentioning throughout the presentation. So in Montreal, we have 4 supervised consumption sites. And these 4 supervised consumption sites, there are approximately 10 overdoses per day, which is the tip of the iceberg, right? Because most of them will happen on the street or private homes. And these supervised consumption sites were first opened and allowed in 2017. And 6 years later, they're still the only ones in the city. And
I'll talk about some of the services in the next slides, but these are only like a few of them. There are others such as Le Trac, Expect de Rue. I couldn't like talk about all the harm reduction services in Montreal, but I just decided to talk about some that I know about, some that I'm more closer with, that I would know better, like how to explain how they work, their challenges, their results, etc. And at the same time, you can find naloxone available in pharmacies, but you'll often have a hard time if you want to get naloxone for a group of people for an event. If you want to get like in a big quantity, you'll have a hard time to get it. Based on what I work with the CSSDP, the Canadian Students for Sensible Drug Policy, and VoxCan, Cactus Montreal is usually what we partner with, and they're the ones helping us get naloxone kits for the events that we organize in Montreal. Next slide, please. So Cactus Montreal is a supervised consumption site, a substance analysis service. They also do screening tests. They distribute harm reduction materials, and they also have a fixed site with support for people who use drugs. And it's a big organization. It's located in Montreal. They have two locations, one with the fixed site and the supervised consumption site, and the other with the substance analysis service, which is called Checkpoint. When you read their annual report, when you get the data they are producing, they have some limitations to age divisions when reporting their services and results. So it's kind of hard to know if youth are accessing their service or people below 19 are accessing their services. It's a little bit complicated. There's a lack of data informing this kind of information. And they also have their fixed location at the same time. In the supervised consumption site, they don't have a minimum age to access their service, which is great because young people, youth can access their service. And at the same time, Checkpoint is their service that they reach a younger population, the substance analysis site. And also the GAP Alternative Peer Intervention Group. It's also, they have the ability to reach young people since it's like more a peer supporting group and program. And the GAP Alternative Peer and the Checkpoint are two services that like better suit the needs of young people who use drugs. And they have alternative, they have different sites, a different opportunity to reach youth in Montreal. And according to the annual report, they also realized that many young people didn't want to go to Cactus, the supervised consumption site. And that's why they decided to start this peer intervention group to like better reach this population in the city. Next slide, please. So in 2022, 2023, they had 85,000 visits, their highest number since 2019. As I said, Checkpoint reaches a younger and more gender diverse population than its other harm reduction services. In 2022, they tested 1,638 samples, and in general, substances were rarely misleading. Only 14% did not find a targeted substance. When testing for opioids, the majority of contamination were from benzos, caffeine, and fentanyl. When testing cocaine, the majority are from contamination from catinone, levamisole, and lidocaine. And when testing meth, the majority of contamination was from catinone and caffeine. Next slide, please. Some of the challenges faced by Cactus in Montreal, first of all, is a staff shortage and the lack of funding. I'm going to talk more about the lack of funding when I talk more about policy and drug policy support from the Quebec government. And one other challenge is the substance detection limitations for the spectrometer. So it needs a minimum concentration of 5% of the sample to be able to give the result. So unfortunately, the methodologies available to Cactus are not sufficient to offer a complete analysis, especially for substances in tablet form such as Dilaudid or Xanax. And it is important to note that there are a greater number of tablet format substances in Quebec than in other provinces such as British Columbia. And due to the high concentration of non-active substances present in the tablet, it is very difficult, if not impossible, to detect the psychoactive ingredients present using this spectrometer. Next slide, please. Another interesting organization in the province is the Quebec Association for the Promotion of Health of People Who Use Drugs. They have a very interesting journal, which is made by and for people who use drugs, called L'Injecteur. And it's a great way to reach people who use drugs, a great way to reach in people who use drugs. You can subscribe for their journal online. They have all the editions available online in PDF
I highly recommend checking it out. It's really an amazing project. And they also provide education materials, education programs, they organize events, they do advocacy, and also provide legal services and support for people who use drugs in the province. And they're also leading the organization of the International Overdose Awareness Day, just tomorrow, in Montreal. So they're organizing an event tomorrow. And I also highly recommend everyone to try to find the International Overdose Awareness Day in your city, in your community. It's a great way to connect with people, support the work, and see what's going on in your city, in your community. And the day is tomorrow, the 31st. Another also great program, great service in Quebec is called Dopamine. They are also another supervised consumption site. They also offer like a day center with social services and educational programs for people who use drugs. They also provide health services and judicial support. They also have a peer-based program, which is great for young people who use drugs. And the goal is to mobilize at-risk injection and inhalation substance consumption, focus on preventing hepatitis C and HIV transmission. Also, there's a lack of age information and age division on their database. So it's complicated to see if they're reaching a young population and what are the results for youth who use drugs accessing dopamine services. And at the same time, youth are able to access the supervised consumption site. They also have a great program that I really like. It's called Brigade Verte. And it's a group of people who frequent their service, frequent dopamine, and they want to get involved in improving their neighborhood. So they organize community programs and projects around the neighborhood with people that frequent dopamine, and also in Montreal. L'Anonyme is another service in Quebec. They have a housing program, and they also have two vans for, there's a typo, but two vans for harm reduction and intervention programs, and also a mobile supervised consumption site with mobile reagents and spectrum analysis service. So this is great because I have the mobile option for both the supervised consumption site and for the harm reduction and intervention program. So they're able to reach different areas of the city in Montreal and go where maybe people who use drugs in the street are, or they're able to have this flexibility when it comes to the location. And they also have a substance use and sexuality education program for youth in between 12 to 35 years old. Another service in Quebec, and I'm also involved with GRIP, is a group de recherche intervention psychosociale. They are, most of the staff at GRIP, they're youth who use drugs. And what they do is they have a mobile event analysis service. They don't ask your age to access this service. It's open to everyone. They're very related and they're very present in more party festive environments. The bigger festivals and other events in Montreal, you'll definitely find a GRIP booth and kiosk, and also GRIP mobile event analysis service there. They also provide and organize training and workshops around sexuality, substance use, and they're very focused in school, high schools, pre-university level, which is called Cégep in Quebec, and also adult education, both in English and French. And as I said, they're very youth focused, and also intervention in festive environments. And also they have a project which is called VoxCan, which is its own organization, but inside GRIP. And VoxCan is this bilingual platform for cannabis education for youth in Quebec, and also by youth. And I'm part of VoxCan, and what we do is we organize tables, presentations, debates, workshops. We go to schools, we go to high schools, we go to pre-university level education, also adult education, both French and English. And we also develop workshops for young people around substance use and sexuality. This is a great idea because it's young people who use drugs providing service for all, although also young people who use drugs. Also, two of these organizations are very related to university, one at Concordia University in Montreal, the other one at McGill. The first one is the Canadian Students for Sensible Drug Policy. It has a chapter at Concordia University. The national organization itself is youth focused, and the Concordia chapter created this program called DMT, Drug Meets Test. We offer reagent kits, and we also do on-site substance analysis using reagents, colorimetric reagents. And our goal is to serve the student community, serve the Concordia community and students who use drugs, test their substances, analyze their substances, and also refer them to other services in the city. We have our own limitations, of course. Colorimetric reagents will have its limitations to, you might not prove the exact purity of the substance. and it's also very different from this spectrometer. And we also offer harm reduction materials for youth who use drugs on site when we test the substance. And also at McGill, there's a program called Making Drugs More Accurate. And they do different. They deliver the reagent kits with instructions and also offer harm reduction instructions and informations to students at McGill. Both are not supported directly by the university, but they're organized by students at Concordia and McGill, and their goal is to serve the university community. Also, some challenges for the supervised consumption sites that I mentioned in Quebec. There is a lack of youth-friendly services and youth section in these centers. As I mentioned for Cactus, they said that they've noticed that youth are also hesitant to access their supervised consumption site. And according to CSAs, the Canadian Center for Substance Use and Addiction, many of these supervised consumption sites in Canada, they do not adequately address stimulant use, as services rarely have options for drug inhalation. And also, only 10 supervised consumption sites and overdose prevention site in Quebec. And there's also a lack of connection and communication with Health Canada, which makes it harder to function detoxification, and safer supply centers. So participants who want to stop using a substance, the dosage given in these centers to manage the withdrawal symptoms, it's not comparable to the doses found in the street. So this lack of communication makes it harder for these detoxification centers in Quebec and also in Canada. So when it comes to funding and resources, recently the Montreal Public Health Authority reduced funding. It was late last year. And for instance, Cactus had a 30% funding cut for sexually transmitted infections. So this directly impacted their staff and opening hours. And at the same time, in July this year, the Quebec government announced $1.2 million for supervised consumption sites, which only allowed them to go back to the level before the cut. So they were not able to go above it. They went back to the levels that they were before the cut funding in late 2022. So when it comes to policy and government, there's a campaign going on in Montreal called City Without Overdose campaign. And the coalition City Without Overdose is demanding the city of Montreal to take action to decriminalize drug possession in the city. So the city passed a motion in 2021 in favor of the CRIM drug possession, but it didn't ask the federal government, in this case, Health Canada, for the exemption. There is a petition, and the coalition asks citizens, Quebec, Canada, Montreal, to pressure the representatives. And the process right now is not moving forward. You can find, if you're interested, more information about this campaign, the petition, and the document on how to pressure your representative if you're from Quebec, and the resources list with the links that we're gonna send after this event. So the idea is that the city would apply to Health Canada for this exemption under the Controlled Drugs and Substance Act to decrim drugs for personal use in the city. And this can be requested by the health authority in the city or province. So I bring here Vancouver and Toronto as examples. So Vancouver applied and received in 2022, and Toronto applied in 2022. Toronto is applied, but is still waiting. Like the request is still being processed, and it wasn't granted until now. So the official position from the Quebec government is by the Quebec Social Services Minister. He said that the government is studying the idea of decriminalization and looking at other examples in Canada, but, quote, they're not there yet. So as we see, there's a lot of announcements and money coming in, but not much effort to tackle the root of the problem. Government is giving money to organizations dealing with the results of the issue, which is necessary, of course, but it's lacking action towards the root of the issues. So the government is dealing or giving money to solve the impacts of the issue that it created by the lack of policy, but it's not trying to solve the cause of the roots and the cause of the issue in the first place. Next slide, please. Also, I wanted to bring the Imagine Safe Supply community-based research by the Canadian Drug Policy Coalition. It's a community-based research project that tried to explore ideas about participation around safe supply. So between January and June of 2021, they interviewed 33 people who use drugs and are frontline workers across British Columbia, Alberta, Ontario, and Quebec. And they wanted to know what they think about safe supply, what they need for safe supply, what they want. So what they found is that there's a limited scope of safe supply. The vast majority of people can't access. The importance of community building and connection, cultural inclusion, trust, which are important steps to guarantee safe supply. Also, the importance of having holistic program models, not a one-size-fits-all model. So being able to choose drug options, doses, modes of consumption. One thing that I wanted to mention about this community-based research is they only mention age once in the end, saying that age must be taken into account, but they don't talk about how this safe supply looks for young people, or how young people are being affected by the lack of safe supply, the lack of access to safe supply. So there's a lack of youth voices talking about how we imagine safe supply. There's a lack of youth-centered perspective. Next slide, please. Also, another safe supply pilot projects. I just wanted to mention very briefly the difference between safer supply and opioid agonist treatment. So the first one, the safe supply, refers to providing prescribed medication as a safer alternative to the toxic illegal market to people who are at risk of overdose, as the opioid agonist treatment is an evidence-based approach for treating opioid use disorder. It involves the use of different medications to prevent withdrawal. And where we could find it in medical clinics, supportive housing, community pharmacies, health centers, and supervised consumption sites as well. And these medications can be opioid stimulants or benzodiazepines. And some of the locations offering these services are funded by the government Substance Use and Addictions Program, the Canadian government. And these services usually they offer outreach and support in the community, medication delivery, crisis support, legal support, housing support, harm reduction support, and also the referral to other services as well. And there's a pilot project, Victoria in British Columbia, Vancouver, and also in Toronto. And one of the challenges found by these pilot projects, so a fentanyl tolerance by the people who are accessing the pilot projects, a shortage of supply or supply interruption, and the limited types of medication, and the participant time requirements, and participant missing doses, medication diversion, staff shortage, and resistance by some professional, and also safe supply programs not meeting the demand. And just going back to the fentanyl one, according to the report of the pilot project, this is the top challenge, is the high level of tolerance to fentanyl due to this high potency. So for those who have been using fentanyl, their tolerance is such that even maximal doses of like hydromorphone have little effect except withdrawal management. And also very important, like the safe supply programs, the pilot projects, and the programs available in the country are not meeting the demand. And this specific slide, I got all this information from an amazing project developed by YouthRise. It's called Operating Harm Reduction Services for Young People. You can also find this in our resources list, and it's a PDF available online, and it talks about how we see youth-friendly harm reduction in general, and here I'm just bringing for Quebec and Canada. I selected some of them. You can find more in the list. And it's important to, the importance, for example, to having these services center supervised consumption sites available for youth, right? So first of all, peer support programs, youth-friendly, more welcoming, safer for young people who use drugs, education programs, so information, how to bring information for youth who use drugs, how can they access the information about substances and the programs available to them. So youth-led initiatives and services, how to lead, how to bring in innovative programs and services that can be led by youth for youth. This is also very important. And having youth and youth use drugs as staff in the organization. So for example, I mentioned GRIP, and also like creating pathways for clients to become staff, and also hiring youth with lived experience on substance use. Having staff trained and informed according to youth needs. So how to communicate with youth, how to talk with youth about substance use, the psychological challenges, being open to diversity, and also being able to like establish trust with your clients. So in this case, it would be youth who use drugs. Another important aspect is to be able to engage youth in developing the programs and the spaces where you're going to have your program happening. So this can create a program, a space, a physical space that is more appealing to youth. You can have the youth engage in sharing opinions on the proper channels, language, imagery of the space, how the space is it's shown to the clients. Also engage youth in formulating, monitoring, and evaluating the services and programs while the service is happening is also very important. Another important aspect is privacy and confidentiality, and also have separate facilities, protected environments, separate rooms, or depending on what you're doing, having a specific service also available for youth that can provide this privacy. And also this is going to make them feel more secure in opening up about their substance use, especially with underage youth. And this specific point makes me think of when I was working with VoxCan, the cannabis education platform. When we go to school, high schools, pre-university levels, sometimes it's very hard to get youth engaged in talking about their substance use because they're afraid of the stigma, they're afraid of the school staff, they're afraid of their parents, they're afraid of other people that are present in their room. So it's very important to be able to provide this privacy and confidentiality to the audience, right? And the clients that you're serving in your program, for example. Another important aspect is to reach youth where they are. So either youth who inject drugs or youth who use drugs. So reach them where they are. So schools, youth centers, online platforms, street-based hotspots for drug use, space of sex work, and other spaces. Also the importance, once again, of using new technology, social media, newsletter, websites, Twitter, Instagram. Also create this opportunity for online harm reduction is also very important through videos, infographic, audios, podcasts. Also providing this package of services. So services that are related to, of course, substance use, but not only, also sexual health, abortion, reproductive services, mental health, legal support, shelters, job search support, housing, education, gender violence. And also being able to reach parent and other service providers, informing and educating them with evidence-based information on drugs and harm reduction. And I also want to mention that Youth Rise organized an event, I think it was a couple months ago, about harm reduction at the table and on how to talk and approach parents and families about drugs and harm reduction at the table. So like at family meetings, for instance, how to be able to like bring this topic to your family, to your parents. It can be kind of like worried to talk about drugs. And yeah, so in general, what I want to add is check out infographic. It's amazing. It's a great resource. And also always pay attention to intersectionality, religion, mental health, gender, color, criminal record. And this also helps to like reduce stigma and be able to provide the best support, harm reduction support for young people who use drugs. And thank you. And if you have any questions, don't hesitate to contact me. This is my email. I'm based in Montreal, in Quebec, and through Youth Rise, I'm in between Brazil, Canada. And yeah, if you have any questions, let me know. Thank you.
Hello, can you hear me well? I hope so. I'm Dinah Macmillan, and I will start with presenting myself and the project that I work for, as I will mention them later. Since I started university in Bologna, I have been interested in harm reduction because as a young person who used drugs, I was not familiar with harm reduction at the time. During an illegal party, I was wondering what effects could stimulants have in case I was taking birth control pills. So I approached a harm reduction point for the first time, and I never saw it before in discotheques or in legal contexts. That project was Lab 57, that is the first project that brought drug checking in Italy in '96. I was told to wait 2 hours after the birth control pill and to take account of my temperature and my hydration. Since then, I never left harm reduction. I've been a member of Lab 57 for 7 years now. That is a self-managed collective that was born from the grassroots, peer-to-peer exchange of experiences and information. Our information are mainly in illegal and our interventions are mainly in illegal and self-managed contexts, such as social spaces and rave parties. We provide chill-out zones and give people safe materials to use substances, clean snorts, clean syringe, Narcan, water, condoms, and we set up chill-out zones. Following these practices, once I moved to Turin, I decided together with other young women, to create a collective of women who use drugs. so that we could make up for the lack of gender-specific information, that it will not be only based on a white male in good shape body. So also include female bodies experiencing menstruation and menopause, but also bodies in transition, so interaction between substances and hormone therapies. Thus, Chemical Sister was born during the lockdown from and following the footsteps of Love 57, so with peer-to-peer exchange of experiences, and keeping the topic of pleasure, because it's a topic too often ignored when we are talking about substance use. From there, we began to question the pleasure of using substances, the preferred practices, maternity, and the use of drugs and chemsex. We also provide harm reduction point, and we follow the roots of sexism-free night trainings. Chemical Sister grew out of the wake of the European Narco-Feminist Sisterhood Network, so we are part of the Eurowood network, and we are going from all over Europe. This is because we face double stigma of being women and young women who use drugs. I now work in a low threshold dormitory for people who use drugs, and I'm precisely part of Youth Rise because I would like to work in the field of drug policy reform and advocate for human rights too often denied to people who use drugs. Next slide, please. The political situation in Italy, it's not that good now, because since some months now we have a right-wing government. So the first measures by the new Meloni government is the introduction of a new norm in the penal code which make rave parties a crime. From a social, political, and symbolic perspective, this new crime asserts that a rave party is anyway and always a primarily of danger for participant and the community. This orients public opinion in supporting the repressive choice, also thanks to a strong and persuasive mass media campaign based on fake and manipulated communication. The use of drugs during these events is emphasized, showed, and incontrovertible, and represented in a distorted way. But what does safety mean? There have been many incidents in Italy of overcrowded discos exceeding the maximum number of attendees. And what about consumption, expensive water, consumption of fast, dangerous substances? There is no harm reduction in legal context. As I said before, the rave party is a setting where I first saw harm reduction, drug checking, and chill out zone. And the first time that I saw free water. And that's a bad point, in my opinion. The network of local authorities committed to an innovative drug policy takes a stand against the amendment of the article of the Highway Code. So many networks are standing against the proposed reform of the Highway Code proposed in the Meloni government. For the local administration, it should be revised. In particular, the passage that provides for the suspension and the subsequent revocation of the license with a 3-year ban on obtaining it. And for those who test positive on a rapid saliva test, fails to take into account 2 factors. The tests have an error of 20%, and the positivity can result even after many days. In a surprise decree, we also have the CBD. The Cannabis Light Decree includes the CBD among narcotic substances, and this was made in the 25th of August 2023. And we are probably the only country in Europe and perhaps in the world that considers CBD, or rather oral use preparations of CBD, to be a narcotic. The most recent initiatives is to give free cabs to people that are going outside the discos drunk. But if you smoke a joint, let's say 2 days before, and have a positive test, your license is revoked, resulting in a requirement, and you have to go to the CERT, which is the Drug Addiction Service. And this is mainly affects mainly young people. Next slide, please. The situation in Italy is since 2016, harm reduction was incorporated into the essential levels of care, acknowledged as a human right. This is an important step because it was desired by civil society and drug users. This law stipulates a right that for every citizen to have access, services, and benefit to protect their right to health. In Italy, harm reduction as an approach to drug policy and as a system of intervention has been adopted for more than 2 decades, in accordance with the evidence and the guidelines that were gradually being developed in the main European countries. However, due in part to the ideological opposition and causing fund for social and health spending, along with the consolidated experience and commitment of many actors, there remains an extremely unequal harm reduction map between regions. There is no law prohibiting or allowing drug checking. So the ways in which it is carried out in Italy are different in particular. Let's say that we Italians are pretty good in twisting the laws and making them as we want. So there is a national early warning system named SNAP, S-N-A-P, to which alerts and test results from harm reduction projects are sent. Again, there is no law that permits drug checking, but projects still manage to get funds through collaboration with chemical laboratories from universities and the Department of Drug Policy. The peculiarity of alerts in Italy is that they cannot be disclosed. The latest one precisely highlights an increase of the purity of heroin circulating on the streets and synthetic cannabinoid alerts, but there is a criminal penalty if we were to be disclosed to consumers, as it's seen as an incitement to use. Is unfortunately what is happening with fentanyl alerts. In the drop-in centers, in the dormitory where I work, for example, and on the streets among peers, there is awareness of fentanyl starting to be spun and no one can prove it. The analyses don't allow for the dissemination of alerts. The analyses themselves are very difficult to do, and people who use drugs experience a high stigma that they don't have much access to right information. I will speak later about the fentanyl project that is going on in Italy with fentanyl strips. Italy's drug policy employs severe administrative sanctions that disproportionately target cannabis users, particularly young individuals. Their sanctions lack a criminal implication, but carry substantial consequences, perpetuating stigma and violating human rights. Since the 90s, over 1 million individuals in Italy have been reported for cannabis-related offenses, with an overwhelming focus on cannabis users, 72.8%. The Italian Constitutional Court decision in February 2022 has intensified the stigmatization and undermined the rule of law, fueling mass persecution of cannabis users. In 2021, the National Conference on Drugs in Italy was held after 12 years that was not being convened, despite the fact that the law it calls every 2 years. The report of that conference was a step backwards of 60 years, where the drug tunnel was still heard. So today, instead, in 2023, the government's a report on drugs were released 3 weeks later, and more than a third of prisoners are in jail as a result of the Italian drug law, and as many as they are drug addicts. A disturbing figure is the percentage of people in Italy arrested for drug-related crimes. Worldwide, we have 20%, Europe 18%, Russia 35%, Italy 34.88%. Next slide, please. The impact of the war on drugs on young people who use drugs. The worst impact that befalls young people who use drugs is stigma, which leaves behind fear and ignorance about dosage, effects, and substance interaction. Conducting several focus groups in 3 Italian cities, Turin, Bologna, and Milan, we asked people aged from 18 to 30 about criminalization and harm reduction. What emerged is that there is a total lack of information about substances and a lot of repression by institutions, such as in schools. One finding that emerged is that at least 9 out of 15 have experienced school searches during classes, and various demonstrations throughout the year by way of terrorism, complete of drug-sniffing dogs. This is a violation of human rights, considering that the people were often minors. The intervention can strain the relationship with family members and friends. Young people may face conflict, stigma, communication breakdowns, and alienation from their support networks. I would like to report an important example that emerged from a focus group. Two young persons, 19 years old, were walking in the park. They are stopped by a police with a drug-sniffing dog, and it was in front of everyone in the park. After having the dog look for the two smoking roots that one of them had in his pocket, the police decided to do it all over again, as it was a game. So they put the smoke back in the boy's pocket, make him walk, and send the dog to meet him again, to experience a trauma and to revive it as a joke. So the consequence was license revoked and 2 months in the drug addiction service. The result is that the boy began drinking disproportionately and consuming stimulants as cocaine on a very frequent basis. Next slide. No, sorry. The same slide. Youth Rise and Forum Droghe, that is the civil society part of Italy, participated in the drafting of a paper submitted to the UN Human Rights Office, where we reported the main human rights violated in Italy regarding drug policies, and this disproportionately affect young people. Since the 90s, more than 1 million people have been reported to the prefecture of cannabis-related offenses. The majority target cannabis users, 72.8%, with only small numbers for the other substances. The disproportionate focus on cannabis users raises concern about discrimination, particularly on young people. The failure to adequately cover harm reduction and the consequent violation of the right to health was brought to the attention of the UN Committee of Economic, Social and Cultural Rights as early as 2019 by Italian civil society. The committee, in line with the many UN human rights agencies, have accepted the complaint and called on the Italian government to comply guarantees access to harm reduction throughout the country and in compliance with the obligation of the convention that Italy signed and is obliged to honor. Next slide, please. Young people who use drugs in Italy can face a range of complex challenges. Health risk, so drug use among young people can lead to serious health risks, including addiction overdose and the transmission of diseases such as HIV and hepatitis through shared needles and unsafe sexual practices. In Italy, drug use is generally considered illegal. Young people who use drugs may face criminal charges, which can have long-term implications for their records and future opportunity. For example, the driving license. Young people who use drugs often face stigmatization and discrimination from peers, family, and society at large. This can lead to isolation, mental health issues, and barriers to accessing support services. There is a limited access to harm reduction services, addiction treatment, and mental health support tailored to the needs of young people. Providing effective prevention, harm reduction, and treatment program tailored to the needs of young is essential to address the challenges and mitigate their negative impacts. Next slide, please. We are facing difficulty accessing fundings. As I said before, we have some institutional projects and self-managed projects. So there are very important ones in Italy that are experiencing a time of reduced fundings. I don't know if any one of you have ever heard about New Travel. And for example, in this project that guaranteed drug checking once a week in the city of Turin, free of charge, anonymous, and in collaboration with the Sanitary Health Association, now is experiencing funding cuts. This project with the Raman spectrometry, through collaboration with university and the Department of Drug Policy, used to report the analysis to the SNAP, the National Alert System. Now the analysis only come from the police, which are done with not quantitative tests, but therefore often bringing erroneous results. Certainly not useful for users, but only for a repressive purpose. As I said in the beginning, most harm reduction in Italy happens from below and among peers. The Lab 57 project is a self-to-manage and self-to-finance project, and the analyses are done with 12 colorimetric chemical reagents on site and always accompanied by counseling. It is through this analysis that we are able to really understand what is going around the streets and what risks people who use drugs face. For example, Lab 57, with the collaboration of a French project, was able to issue an alert on methoxetamine that was sold as ketamine. The same goes for the chemical sister, which does not perform drug checking, but researches a lack of information gender specific, and also promote training for clubs and staff based on the guidelines of the European project Sexism Free Night. They therefore also fill gaps regarding gender violence in the nightlife world. Next slide, please. Now I will read this data from the drug white paper, that is the Italian report from 2022 by civil society, so not from the government. More than a quarter of inmates enter prison for detention. Over 30% of those entering prison use drugs, and this is a catastrophic record over the 17 past years. The crackdown mainly affects cannabis, then cocaine and heroin. More than 1 million people have been reported for possession of cannabis derivatives since the 90s. 33% increase in underage reporting for drug use. This is not meant that they consume more, but that they are more subject to repression. Next slide, please. The harm reduction knowledge in the area. Regarding naloxone, in Italy, we have a problem with availability. By law, you can buy 1 dose pack for naloxone without a prescription, but you can't buy a 5-pack but you can't buy a 5-item pack. You need a prescription for that. Despite it being a life-saving drug, by law, if a pharmacy don't have a naloxone, it risks to close. But as I said before, in Italy, we are really good at changing the laws in our willing. So it is possible to have a permit that allows the pharmacy not to have naloxone. With Chemical Sister, we made an experiment in the city of Turin, and out of 10 pharmacies, only 1 had naloxone. And the experiment was in a neighborhood where drug use is very high in the street. Once we found the pharmacy that could give us 1 naloxone, they were asking what was our proposal, what we wanted to do with it. So there is a big ignorance about naloxone, and there were many stigmatizing questions. The police officers themselves are not trained on overdoses and naloxone, and this is often withdrawn from the consumer drug during police operations. So they take it away from people. People who use drugs, and especially young people who use drugs, are not informed about the key alerts, and they can't rely on drug checking because we only have projects in the whole country. As I said before, the main methodology in Italy are now Raman spectrometry with the Bravo and the Shimadzu model, and the colorimetric system with reagents. Unfortunately, there are some regions where are using the Z tests, that color in contact with substances, but they are ineffective and they are not followed with the counseling. The fentanyl tester introduced a free self-analysis kit to detect fentanyl in heroin. It's developed by Open Group in partnership with the Emilia-Romagna region and Bologna's local health authority. The projects empower citizens to identify this dangerous substance, fostering a reporting network to enhance community safety. With a focus on collaboration and citizen participation, the initiative holds promise in mitigating the risk linked to substance use. This analysis covered 12 fentanyl variants, including the most common ones. The process is completely anonymous and can be conducted either directly or on substance or on urine samples. Thank you very much. I will leave the floor to my colleague Anna.
Hi, everyone. I hope you can hear me. My name is Anna, and I will be presenting the situation in Georgia. And well, even though my experience is limited to Georgia, I think it will cover the Caucasus region in general. So you'll get the picture. So, well, I forgot to mention about me. I'm a member of Georgian harm reduction community called Mandala, where we mostly orient on young people who use drugs. We provide services such as drug testing, which is the maximum that we can do according to our law legally. We don't have safe consumption sites, unfortunately, in Georgia. And I have recently become a member of the international working group in youth rights. So, well, yes, next slide, please. I wanted to start about describing the situation in Georgia, especially the club scene in Georgia, because, well, Georgia is small country, but we are all about like music and dance, and it has been in different shapes throughout the history. And in the past 10 years, techno music has become very popular in Georgia. So logically, the drug use has also become more popular in the past 10 years amongst young people. It has been always there, but nowadays it's becoming more popular, and young people are becoming very interested in drugs, but they are also confident even without the lack of knowledge how to mix the drugs, and this is becoming a big issue nowadays. On the other hand, we have Georgian super harsh drug policy. By the way, I'm very surprised by the Italy situation. I thought like Georgia was very harsh, but apparently Italy has very bad situation, according to Dinah's presentation. So, well, basically we have also very strict drug policy in Georgia, where mostly Georgian government is thinking more about the legal side and not about the human health and lives. We have in 2015, we have a legalized use of marijuana, weed. That's the only success that we have had after long fights for the normal drug policy. Other than that, any drug consumption or having any even the small amounts of drug on you can lead to jail, and the sentences starts from 7 years to 20 years. Comparing to, let's say, if you are murdering a person, the sentence for murder is 7 to 15 years, and for rape, where its maximum is 8 years. So yes, the drug use and obtaining and having a drug on you, even a 0.5 milligram, is considered a very big felony. Also, policemen have a big power in this picture. Whereas, like, if you are, policeman, like a regular policeman, decides just on the sufficient grounds. And by sufficient grounds, I mean like their own intelligence. They think that a person might be under the influence of a drug. They have all the right to stop you, to do all like checking, and then even if nothing can be found, they can take you to the police station where you're forced to give a urine test. And like they can hold you there for up to 15 hours, and during this 15 hours you are not allowed to even make a phone call. So yeah, this is our situation. And as Dinah mentioned, there's like 33% of drug-related crimes in the prisons, in prisoners. It's almost the same in Georgia. Up to 30% of total people who are in prison are drug-related crimes. Yes, so next slide, please. Oh, yes, consequences are obviously very bad and brutal. We had a very tragic outcome. Other than what I already mentioned, police has this approach. Policemen actually, they get some additions on their salary after filing a case about certain criminals, and so they are very motivated to find young people and catch young people who use drugs, so their salary will be bigger. So we had a case, a tragic case, where in one part of Georgia, a young man, age 20, he was growing weed in his backyard for personal use. And the policeman who was his neighbor found out that about that, and he started to have make a deal with this man, a young man, that this young man had to name other people, his friends or the people he knew, that also smoke or also grow weed. And that was like basically the deal. So this young boy wouldn't go to jail, or he would not have to pay a very high fine. So basically, it was so stressful for a guy that this young man finished his life. And before hanging himself, he wrote a letter where he described everything. Like he mentioned names and everything, what was going on, what led him to make such a tragic decision. But unfortunately, the judge found the policeman not guilty. And well, this is how tragic the situation gets here. Next slide, please. Yes, as for the rehabilitation services, we have just 2 weeks rehabilitation detox programs from the government, and that's it. After 2 weeks, you are left on your own, and there are only commercial rehabilitation centers that are super expensive, not only for young people, but for normal people in Georgia. So this is something that young people especially cannot afford. Next slide, please. I think I'm talking pretty fast. Yes, now at Mandela, as I mentioned, we have some services. Even though having given small amount, carrying a small amount of drugs means that you are at risk of going to jail, people still come to us to test their substances. And this is basically the only way that we can collect data about what substances are in our country, what drug trends we have, because the government itself is not interested on running their own data, collecting their own data, or doing their own research. We have a shift from alpha PVP to fentanyl and methadone recently, but it cannot be called a trend still, not a big amount, but still, yeah, that's the drug trends that we have. Next slide, please. Yes. So since having, buying, carrying, using drugs any amount means a very high risks for anyone. It means that the prices for the drugs itself are very super inflated. So let's say the average salary in Georgia for young people would be something like 400 to 500 Canadian dollars. That will be like 350 euros. Whereas a single tab of MDMA could cost up to 80 80 euros, like 100 Canadian dollars. So basically it means that young people who want to buy drugs, first of all, they have to pay quite a lot. And then there is what we call here a treasure hunt of how you can actually get drugs. So I'll briefly describe how we get drugs here. So you have to go to the like a safe chat, where what is like a Telegram chat, let's say. You have to find the dealer there, and you know nothing about the dealer. It can be anyone. And then after sending the money through like Bitcoin or some other channels, you get a location and a picture. You go on the location, and while you're going there, you are under stress because the dealer can just give your information to the address to the policeman. They could be there waiting for you while you get there, looking for your drug. But if you're lucky and there is no policeman and you still get to the place safe, then you have to find the location. Then you have to, like, holding this one single picture, like a piece of puzzle, you have to find the exact spot. Then it can be under the rock, under the tree, in the ground, dig the ground. And finally, if you are again lucky and somebody else has not found the drug, you get the drug. Then, well, not everyone, but fortunately, more and more people now come to Mandala, or they get their own drug testers and they test the drugs. And with our own experience, we had a lot of cases, like 4 times out of 10, when young people come to us, they test their drugs and we find a fentanyl there, they would still say that, never mind, even though we know that there is fentanyl, we are still going to use it because it costs so much to get hands on the drug, then pay so much, like they just risk it all. So yeah, next slide, please. Well, yes, we have insufficient mental health support, and other than support, there is lack of professionals who understand, who know, at least know and understand the problems that could be unique for young people who use drugs. You can get bullied or become a victim of stigma by your own psychologist. I personally had this experience. And if you want to find a good professional psychologist or psychologist, again, they are very few and super expensive. As for the statistics, as I mentioned earlier, government is not running any data. Most of the data that we have is collected by international organizations. Literally everything, every success that we have in the country, if that can be considered a success, is because of, obviously, first of all, the young people and other people who fight against this harsh drug policy. And also it's a huge help of international organizations in the terms of drug policy. Next slide, please. We recently started collaborating with the government. That's I forgot the name of this organization, but one of the international organizations requested for Georgian government to run the early notice system. So this is good news. And Mandala also started to collaborate with the government. So whatever data we have during festivals, during drug testing in our office, we provide it to the government. So yes, this is how we are basically in the foundation of this early notice system yet. Next slide, I think that's it. Well, yes, that's basically it. We definitely need changes. The use of drugs in young people are become more and more popular, and I think it's very unique. Only young people can use drugs with such a confidence, even though having a lack of information, and still, like, our society is very supporting. Even we as a Mandala, we go to the festivals, we have volunteers, and the volunteers are not paid. They just get free ticket to the free entrance to the festivals, and that's all they get. Plus, we require them not to drink, not to smoke, not to do any drugs while they are volunteering. But still, they are just doing it because they want to help others. So this is basically the only source of support that we have nowadays, and government is nothing but against whatever we are doing now. That's it. Thank you.
Thanks so much, Anna. That was really great to hear from you, and it was great to hear from all of you sharing your experiences. It's rare that I get such an in-depth look at the situation for young people who use drugs and people who use drugs in general in each of these countries. So it was really, really great to see all of those facts, and also really sad to see about the situations as well, and the severe gaps in service provision, and the laws surrounding drug use as well being so harsh. So just to kind of wrap up the presentations, I just wanted to share some calls to action. So the first one being to invite you all to inform yourself about the unique, nuanced realities of young people who use drugs, and you can do so through checking out our resources. We have a resources page. Also in the document that Lisa has shared in the chat, there's all of Youth Rise's linked sites and social media and reports and things that we think you should have a look at. So for example, I linked here one on health, which was on universal health coverage for young people who use drugs, and the importance of it and the significance it would have on our lives. What harm reduction services should look like. So João quoted it quite well earlier on in the presentation, but we have another, if you want to have a look, there's an infographic version of what youth-friendly harm reduction services look like, but there's also a longer report that looks at youth-friendly, some more and some less, harm reduction services in every continent in the world, which is quite interesting to learn about. And then it wraps up with the recommendations of what we could be doing better in general, which is what João shared in his presentation. Then also we have publications on the intersecting identities of young people who use drugs. Last year we came out with a narrative paper on young sex workers who use drugs, and the year before on young women who use drugs. And this year we have a young people who use opioids paper coming out towards the end of this year. So it is interesting and good to learn about the different intersecting identities and the different ways of use that we have. And like we said, we're trying to fill that evidence gap. Then also another call to you all to contact João. He's our contact in Canada, and so we work with and through João. So if you have any needs, if you know and identify needs and challenges faced by young people who use drugs in your communities in Canada, to send any reports and information you have to João, so we can feed that along to us, and we can make sure that we represent these challenges in the international forums that we're in, the UN bodies, and the working groups that we are present in as well, to make sure that the needs are heard. Also, we have released ahead of, some of you might be aware, I'm not sure if you're not so involved in the advocacy sphere, but the Sustainable Development Goals Summit is coming up in September. And ahead of this, we have created a policy brief that explains the need for advancing youth-centered policy and health and policy coherence for sustainable development. So it links how the criminalization of young people, young key populations, how that will mean that we do not achieve the Sustainable Development Goals, and trying to fill the gaps in the current zero draft for this summit. So if you have an interest, please check out the policy brief, and also if you have any connections to people in government, or if you can push it along even better to any of the permanent missions, Canada's permanent mission in New York as well. That would be great. If you have any questions about that, you can contact João or myself, and we can help to set you up a bit more with some more information. We also have a biannual newsletter. So I've also linked there the first semester newsletter. So if you want to learn what we did for the first half of this year, and you can kind of keep up to date with us there. And also, if you are wondering, we just about kind of statistics on young people and our inclusion in the statistics out there. The World Drug Report from the UNODC, UN Office on Drugs and Crime, came out in June. As usual, there's little on age disaggregated data on young people who use drugs and young people in general, but what is there was showing a continued rise in young people using drugs, and adolescents and school-based adolescents using drugs as well. We basically responded to each of the sections in this World Drug Report with a youth response, which you can find that report on our resources page as well. So we basically kind of reflect back the information they provided to us with what we think that they should do to make sure that they keep us safer. So in terms of drug education, so when they're saying there's an increase in drug use among school-based adolescents, then we need to be teaching better drug education, not based on fear-mongering and lies and those kind of scary statistics that don't actually keep anyone safe or informed about the drugs that they're using. So that's something we called for. We also looked at the impact of the war on drugs on the climate and how that affects young people, as it's our future, so intersecting with those other movements. It's an interesting document to look at, because it pulls out everything from the World Drug Report, which is a long document where they mention youth, and then responds to it with how we think they should be reflecting that data better. So that could be something that could be of interest. So yeah, there's lots on our resources page. You can check us out and follow us on our social media as well, and see what we're up to. Join any of our events if we're having them. And yeah, we really appreciate you all being here today to learn about Youth Rise and learn about the situation in the different countries around the world. And yeah, we hope to engage with you all soon. Thank you.
Thank you so much, Ruby. Thank